Hi, my name is Julia. I'm a senior in college and I have PCOS or Polycystic Ovarian Syndrome. PCOS is a hormonal imbalance. Many people don't know that they have PCOS actually until they're having trouble conceiving. However, it's important to get diagnosed early in order to begin managing the condition so that the long-term risks associated with PCOS, such as heart disease, stroke, and endometrial cancer, can be reduced. Part of the trouble with diagnosing PCOS is that it presents very differently in each woman with the condition. I first knew something was wrong because I would skip periods for months at a time. I had some acne, but the only really abnormal thing I noticed was the periods. For years, my gynecologist told me that my periods would regulate themselves, but 7 years after I wasn't getting regular, I asked if something else could be wrong. The blood hormone tests I underwent were in the normal ranges, but the ratios between two of the hormones was abnormal. So my doctor prescribed an ultrasound, and after getting that, I saw that there were a lot of cysts on my ovaries, and that's when my doctor concluded that I had PCOS. When I first found out, I was very upset because I didn't know what it meant for my future in terms of increased risks for things such as stroke and also especially having a more difficult time having children, because that's something I had always seen in my future. However, with the birth control pill, my PCOS has been quite manageable, and I've since learned that there are plenty of options to reduce PCOS symptoms and induce fertility. And some of those ways to do that are through lifestyle management, such as getting proper amounts of exercise and limiting carbohydrates. Other ways are various medications that you can take. So overall, I encourage anyone who thinks something might be abnormal, no matter how small you think it is, and even people who haven't noticed anything, to ask their doctor if they could have PCOS and what their risk might be, and also to get tested for it just in case. It's really key to start early so that you can live a long and healthy life even with this condition. But my story is just one of the many stories that are out there. And so in this video, you're going to hear stories from two other women who are also college-aged that have PCOS and how they are living healthily with the condition.
Hi, my name is Erin. I'm also a college student, and I've had several friends that have been affected by PCOS, so I'm going to share the story of one of those friends. So this is directly from her words. So it took nearly 6 years for me to be diagnosed with PCOS. When I was 16, my pediatrician tested my thyroid, and there was nothing abnormal. She referred me to a pediatric endocrinologist when I was 17. He said I had elevated cholesterol and told me I should take medicine for that. Something seemed off about that diagnosis, so I didn't go back to that doctor. Both doctors attributed my irregular periods to stress. I felt really hopeless and didn't revisit the issue until my sophomore year of college. A doctor at the University Health Center tested my prolactin levels but didn't find anything abnormal. Finally, after I turned 21, I went to an OB/GYN and explained all of my symptoms. I didn't expect much, and because I'd gone to so many doctors already, but my new doctors ran blood tests and ordered ultrasounds, as she suspected I had PCOS. Looking back, there were so many signs. My extremely irregular periods were sporadic. I don't think I had more than 4 periods during my first years of college. I had inexplicably high cholesterol. I gained close to 50 pounds in less than a year of high school, even though my physical activity and diet remained the same. I developed severe depression and anxiety very quickly. It was so bad that I was sent to see my psychiatrist and psychologist. They were confused because nothing had really changed in my life, but all of a sudden I was depressed and having panic attacks. I took different antidepressants and anti-anxiety medication. Some of them gave me severe side effects. I remember I slept for 19 hours after trying one anxiety medication. On more than one occasion, I was suicidal and my parents were afraid to leave me alone. I had to withdraw from high school during my junior year. I was diagnosed with PCOS just a few months ago, but I've been doing my research and trying to make some lifestyle changes. I started taking birth control pills because it helps balance my hormone levels. I've cut a lot of carbs from my diet and I try to be more conscious about what I eat. I've started exercising more. Women experiencing some of these symptoms should definitely consult their doctors because PCOS is complicated and can affect so many aspects of your life. I was misdiagnosed several times. I was separately treated for high cholesterol, depression, and anxiety for so many years. My academic performance and social life suffered. I was embarrassed because I had no idea why my life was falling apart for no reason. If I had known about PCOS earlier, I could have begun managing it years ago. I didn't think my severe depression and irregular periods could be related. They seemed like completely different issues. A medical professional would be able to provide better guidance and hopefully tie these symptoms together.
name is Proma Chaudhary. I'm a sophomore government politics major here at the University of Maryland, and today I'll be talking about my PCOS with you. So I feel like it took me a while to get diagnosed. I first went into the doctor with a concern when I was 16, just a general doctor. I explained some symptoms I was seeing. Luckily, I knew what to look out for because my own sister had it for so long. Some of the signs I had were hair loss and towards the front, hair gain in abnormal places, significant weight gain, and abnormal amounts of acne. And so I explained these to him, and he basically said, you're a teenager, your body's just changing, dealing with hormones. A lot of women just use their body image issues to kind of blame it, find a source to blame it on, and that's PCOS. That was really off-putting for me, and he told me, look, your body is a bank. What you put in is what you get out. So I kind of put the idea of having PCOS at the back of my mind. Freshman year of college came along, and by February I realized I hadn't got my period in 4 months. Now throughout my ever since I got my period, it has been irregular. I get it every 50 to 60 days, but this was the longest amount of time. September to February, I didn't have a period. And so my mom and sister have a trusted gynecologist, a specialist. I went to her, and within one visit, she said that she's pretty sure I have it. Not only with those symptoms, but the fact that I have velvety skin under my armpits and in between my elbow creases. And so she put it in for me to get an ultrasound, and after my ultrasound came back, we found out that I had cysts on both of my ovaries. And so to deal with this, I am insulin resistant, and I do have a low metabolism, so I have to stay away from carbs and sugar. I went to an endocrinologist, another specialist, and I was given the choice of either going on birth control or metformin. I decided to go on birth control to regulate my period and also deal with some of my symptoms. I also am encouraged to put as much physical activity into my day as I can. I would tell women to get diagnosed if they feel like I felt like there was something wrong with my body. I knew I saw these changes. Not everyone sees these changes, but my doctor told me I was lucky enough to recognize that I had it when I was at this age. A lot of women go years and years and don't really realize it. She did tell me that it would be her, my partner, and me when I wanted to have a family, and family is really important to a lot of people, and infertility issues are related to PCOS, so it really does affect a person's ability to have a family. It also really has changed the way I look at my body, and when I wasn't diagnosed, I just felt like there was something off and I couldn't do anything to control it. My body was out of my control. I was dealing with self-confidence issues, body image issues, and so I think women should get it checked out. It's better to be safe rather than sorry.